In hospitals, proper laundry procedures are crucial to ensure the hygiene and safety of medical fabrics, including patient clothing, bed sheets, towels, surgical towels, and medical staff uniforms. The key points for hospital laundry procedures are as follows. Firstly, the washing procedures must achieve hygienic isolation by ensuring logistics cleanliness and separating clean and dirty items. The washing equipment should use an isolation-style washing machine with two doors separated by a wall. Secondly, to prevent cross-infection during washing, isolate and wash dirty textiles promptly. Sort them again before washing based on texture, color, dirt type, and level for separate washing. Thirdly, after receiving the textiles, they must be sorted and pre-washed. The textiles must be sorted into different washing machines according to different categories. Fourthly, the logistics process of medical textiles is composed of washing areas, drying and ironing areas, folding areas, and clean textile storage areas, which are separated from the dirty textile storage area. Fifthly, medical fabric hygiene is crucial to prevent cross-contamination throughout the entire process of washing, collecting, and delivering medical fabrics and uniforms. The washing process must ensure logistics and cleanliness, with dirty and clean laundry being strictly separated. Sixthly, quality standards require that the fabric be free of stains and discoloration, with a total bacterial count of less than 200 CFU, 25 square centimeters, and no detectable pathogenic microorganisms. The pH value of the fabric should be between 6.5 to 7.4. Seventhly, water quality is critical, and water used for washing medical fabrics should undergo softening treatment to ensure the highest quality. Lastly, pre-washing is critical to remove any debris, dust, or visible stains before thorough washing and disinfection. In conclusion, following these procedures can ensure the hygiene and safety of medical fabrics, prevent cross-infection, and provide high-quality medical care for patients.